Hello, my name is Chris Robinson. I'm one of the neurointensivists here at the University of Florida, and also one of the PIs for the Boost 3 trial that we'll be conducting here at our institution for severe TBI. During the Boost trial, we will enroll patients with severe TBI, looking at either ICP alone or ICP plus brain oxygen monitoring to determine if treatment of patients' brain oxygen improves outcomes compared to standardized treatment. When a patient is enrolled in the trial, they will also be hooked up to the monitor that you see in front of you, which is referred to as a Moberg CNS monitor, which is a multimodality monitor that looks at everything from blood pressure, oxygen, all the way to ICP and brain oxygen. It's an integrative monitor that allows us to not only see what's happening with the patient, but also gives us an algorithm by which we can help the patient through their ICP spikes and their low PbO2. So this is an introduction to the monitor and how it works and what you'll be seeing at the bedside. So when a patient gets admitted to our ICU and enrolled in the trial, they will either be randomized into ICP alone or ICP plus PbO2 monitoring. When a patient is brought into the ICU, myself or Dr. Lisa Merck or one of our research coordinators, namely Amy Holland, will hook this monitor up to our Philips monitors in the ICUs. Now, the Philips monitor will not be off during that time. You will be able to see your normal vital signs on the Philips monitor, but you will also see the similar vital signs on this monitor, which will be collecting the data that the patient has during their enrollment in the trial. So when a patient gets moved into the ICU, we will click the new patient option. It will give us this screen where we want to, quote, begin monitoring. The viewer select protocol is already set up for the Boost 3 trial, so we don't have to mess with that. When I click begin monitoring, myself or the research coordinators will know the randomization of the patient, and we will click either ICP alone or ICP plus PbO2. In this case, let's pretend that the patient was enrolled into both. This will ask for our password that I will enter now, which is strictly for the research staff. And then will show us that based on the equipment that we have at UF, our primary ICP monitor is a Realmatic ICP monitor, our primary blood pressure monitor is IntelliVue, Philips IntelliVue monitor, and our PbO2 is a Realmatic, and our temperature is also IntelliVue, so we'll select. At this point, we'll enter all the patient information for the trial, and it shows that the study group that they're in here is ICP plus PbO2. So we will click done there. We will also have the option to go through all of the trends that we want to see on our monitor. That's not something that the nursing staff has to worry about, but we will, as we enroll the patient, select what we want slaved from the Philips monitor onto our monitor. And once we're done with that, we'll click done. So what we'll get here is something like this, and it'll show us monitor trends. We'll have arterial blood pressure like we do on a Philips monitor, we'll have our ICP, and we'll have our PbO2. Now, what's interesting about this monitor compared to the Philips monitor is there's a built-in algorithm in this monitor that says, hey, your patient has high ICP, you need to do something about it, or hey, your patient has low PbO2, you need to do something about it. So as these trends go on and these question marks become numbers that are elevated, there is software in this monitor that will help us trigger treating the patient. So in order to do that, I have to turn that on for the bedside nurse, and it's something that looks like this. This is referred to our care path view. This is probably the view that we'll use during the trial. And very similar to what you saw earlier, it's not as pretty, but you'll have the ICP trends, you'll have the PbO2 trends here, you'll have the arterial blood pressure trends, and so forth. And if the patient has a spike, an ICP, for example, above 22 for 5 minutes, what happens is something called care path comes up. Care path allows us to determine what step in the algorithm or the TBI protocol that we have developed at the University of Florida that we want to choose for that patient. So for example, once it comes up, we have all these options. Does the patient have just high ICP? Does the patient have just low PbO2? Or does the patient have high ICP and low PbO2? And you hear that monitor, that will happen That will happen when we're in the ICU, and that tells us that we have not turned this on for the patient. So that alarm is something that I wanted you to hear in the video. It will tell us that we have not set this up to allow us to go through the algorithms. So back to what I was saying is it gives you the option to go through each tier, whether it's high ICP, low PbO2, or high ICP and low PbO2. We'll get back to that in a second. But when we are just doing standard monitoring of the patient, there are options for the nursing staff, if they so choose, it's not mandatory, to say, for example, I have an art line issue. So the flow doesn't appear appropriate, there might be a clot in the catheter itself. And by pushing that, it just puts data into the monitor that lets us know, you know what, we're reading a blood pressure of X, Y, or Z, but it's probably not accurate because the art line is off. If we open the EVD, we can tell the system that we opened the EVD. And to get to this, it's just in the monitor option. So if I switch out of the monitor option to the high ICP algorithm, it switches. But if I go to return monitor, I can say that ICP is non-functional, I can say that PbO2 is non-functional, I can say that we're doing an FiO2 challenge, which the research staff will do, and so on and so forth. So for example, if you get an alarm like you just heard and the patient has high ICP alone, the research staff or the practitioners taking care of the patient at the bedside, or even the nursing staff, can click on high ICP. And what that does is, in the first tier of the algorithm, these are the things that should be considered when a patient has high ICP. So for example, if our head of bed is already at 30 to 45 degrees, the patient's temperature is 36.5 degrees, and we think, you know what, giving some hypertonic saline is the way to go. I'll click on hypertonic saline, and based on the protocol, it tells the practitioner exactly what they need to do here. You can use anywhere between 1.5% to 3% hypertonic saline. If we choose to do it, I click there, and it goes into the chart. And so it's a nice way. We built this huge algorithm here at UF with 3 or 4 pages that is based on evidence, but this can run you through that. So if you have no improvement on tier 1, you can then go to tier 2, which has different options, and it just helps remind both the nursing staff and the providers kind of how to manage this effectively in a tier-based algorithm approach, but it also, by clicking, puts it into the monitor for us so that we can actually look at this data prospectively and see what works and what doesn't work. Now, the other thing I want to show you is we do have the option here to switch desktops. Now, you heard that alarm earlier. When we originally pulled up the CNS monitor, we had this view. So this view is nice. It's simply a monitor, though. It does not have that algorithm that I just showed you. So to use the algorithms, I have to switch desktop again. That takes me back to where we were. And if I'm out of the ICP crisis, let's say I gave mannitol, it tells me how much. I'll push it to say that we gave mannitol. We're out of ICP, we can return, and I can go back to this summary option here, and it takes me back to my monitor. So again, this is the monitor screen that we're going to use the most. If a patient's ICP goes up and it's under 5 minutes, the provider can push the care path option and come to here. If per the protocol it's sustained over 5 minutes, there will be an alarm at the top telling you that the ICP is up for more than 5 minutes. You'll touch that, and it will immediately take you to care path where you can enter those things. Again, there are options for nursing staff if they so choose, where they can help the trial by putting in extra data, like the art line isn't working. And that's supplementary data that we can use in our trial. Now, the only other thing I wanted to show you, if I switch back to this desktop, there are some other things that we can mark that we can play around with. Now, again, this is not mandatory for nursing, but if you come on this screen and click Mark Event, you can also say that the patient's getting a central line, for example. You can say a nursing observation that the patient had a seizure, a clinical observation that there's some right eye deviation, left eye deviation, and so forth. Again, these are not mandatory. The research staff will try to help as we go through this, but what we found at other sites is that nursing ends up getting pretty interested in this, and they actually do a much better job than the research staff, including the PIs. And so the plan to roll this study out and use this monitor will be over the next couple weeks, but I wanted to make this video rather than trying to get to each unit individually and having people forget what we talked about. We now have it in a video format that we can pull up every time we get a patient admitted, and we can review this, let's say 2 months later if we get our first patient. So again, The two big things that you want to focus on when you get it into your room is you want to have both screens open, which the research team will do for you, but you can switch back and forth between desktops where you can monitor patients equally. But in this format, which is referred to as Care Path, it gives you the algorithm to manage these patients. It also gives you the option to say, my art line's not working. If I click switch back to my desktop, it's my standard CNS monitor. And that will conclude the tutorial for now. We will be available for further questions related to the CNS Moberg monitor. Have a nice day. Thank you.